Okay, so today we are gonna study about the alcohol use disorder. Cool. So we'll start with the definition, which is according to the DSM-5 criteria. So alcohol use disorder is defined as medical condition. Basically, it's a problematic pattern of alcohol consumption that leads to impairment or distress. It's diagnosed based on the presence of at least 2 out of 11 criteria in a 12-month period. So, what are these criteria? So, these criteria include craving alcohol, failing to meet responsibilities, like they are not able to fulfill the responsibilities, and then developing tolerance, experiencing the withdrawal symptoms. Now, I'll tell you about the terminology. So basically, earlier what used to happen, they used to define as like alcoholism, alcohol abuse, alcohol dependence, or so like why there is a change in terminology. If I talk about today, basically, they use the term alcohol use disorder. This changes it happens because to reduce the stigma and promoting more understanding. It's important because it shifts the focus from the labeling the individual to recognizing the condition. Like imagine calling the individual is alcoholism or alcohol abuse. So it's better to use alcohol use disorder or um a person who is having alcohol with disorder. Okay, now talking about the severity of the disorder. So basically, DSM-5 categorizes AOD. We can call this AOD into 3 severity levels based on the symptom. So first is mild, which is 2-3 symptoms. Moderate is 4-5 symptoms, and severe is 6 or more symptoms. Okay, addiction cycle model. So basically, what is this? That is, I'll tell you how alcohol changes in the brain. So, um, first we have to understand that how the AOD, like how it affects the brain. So AOD is just not a matter of poor, decision. It's a brain-based disorder. So basically, what happens that if there is a chronic alcohol consumption, it rewires the brain reward system, and then it alters the functions, which is leading to the consumption to drink, even though they're facing the negative consequences. If I talk about the basal ganglia, so it basically this is part of the brain which is responsible for reward processing. And then what happens that if a person is consuming alcohol, so it becomes sensitized to alcohol. It increases the brain's craving for alcohol, reinforcing its consumption over time. And then if I talk about the amygdala, so it is responsible for what do we say? Yeah, emotion regulation. So this part of the brain becomes hyperactive, which can result in the stress responses. Why stress responses? Because it's responsible for the emotion regulation. But if you are consuming the alcohol, so it gives you stress responses. Now, what happens that this alcohol basically it numbs the emotion, and the individuals is like they feel that they're compelled, they're forced to drink the alcohol. Now, prefrontal cortex. So basically, if I talk about the prefrontal cortex, so this is also part of the brain which is responsible for decision making and decision making uh, and that also impulse control. Yeah, sorry. So if that becomes weakened, so it creates difficulty for individuals to to make decisions, and that's why since the decision making is affected, that's why they're not able to control their alcohol use, and that's why they faces the negative consequences. Now the risk factors. Wait. Okay, so risk factors. So if I also genetics. Okay, so up to like 60% of the population, 60% of the risk for developing AOD is genetic. Okay, so uh, le- uh, genetic predisposition responsible for why some people are more vulnerable to AOD. And then another is environment. For example, childhood trauma, stress, and family history of alcohol. They can increase the likelihood of developing AOD. And of course, the early exposure to alcohol. And then mental health, the mental health disorders like anxiety or depression. They can also increase vulnerability. And sometimes what happens that individuals also consume alcohol in the form of self-medication. Now, withdrawal and detoxification, the risk of what happens when they suddenly withdraw, when they suddenly stop. So when they suddenly stop drinking, so they face the withdrawal symptoms. So, for example, seizures, anxiety, and the blood pressure increases. And that there was one more thing. What's that called? Delirium tremens. Yeah. So, what is delirium tremens? So, delirium means confusion and disorientation, and tremens means shaking or trembling. So, what happens that it happens when a person who has been drinking, like for a long time, and they somehow decide to suddenly stop, or reduces their alcohol. So, they the brain, which was already adapted, so it becomes hyperactive. About it, and which can cause confusion, hallucination, agitation, shaking. That's what it means. And then detoxification. So basically, it is important to stabilize the individual. And basically, before the actual treatment start, it is important, to give the individual to stabilize, which is known as detoxification. And also, detoxification is not a cure; it's just the first step in the recovery process, which I'll talk about the recovery process. So this is the recovery process. Wait, sorry. Okay, so basically, the good news is that AOD is a treatable condition. We all know that, but treatment should be individualized. Okay. So first is behavioral therapies, like cognitive behavioral therapy, the motivational interviewing, and the mindfulness-based therapies. So basically, why these therapies? Because it helps us to change the behaviors, and it revise the thought patterns that contribute to the drinking. Then medications, like the psychiatrists, they provide the drugs like disulfiram. I don't remember other medications. So they can help us to reduce the cravings, and also like whatever the effect they will face after the withdrawing of alcohol, they help us to reduce that also. And then there are groups as well, in which for like smart recovery, and basically there are group therapy also. Now, recovery is a long-term commitment. It is a long-term process. So basically, there will be setbacks, there will be relapses, and of course, relapse is a part of the journey. So brain is adaptable, and if there is a proper treatment, like proper treatment, so the addiction of the brain, it can be rewired. And what is rewiring? I'm saying it is known as neuroplasticity. So what happens in the process of neuroplasticity, that it allows the brain to form new habits, and create neural connections that supports recovery. Okay, these are the symptoms. Like I think everyone knows, like drinking more or longer than intended, persistent desire, great deal of time obtaining, using or recovering, craving, failure to fulfill major role obligations, responsibilities, and then continued of use, giving up on the important activities. Basically, even if the people they know the knowledge, they're aware about it, they still face status symptoms, and of course the tolerance and withdrawal that we already discussed. And impact is like it affects the work, like relationships, and if you're studying in school or college or anything, or work, that affects that also. And it does causes the brain changes. And according to the 2022 survey, like it's a US study, so 1 in 7 men, 1 in 11 women, and 1 in 33 adolescents, and from the age of 12 to 13. So basically 18 million people, it has been reported that they consume alcohol. And yeah, that's it. Now, there's an MCQ for you guys. So you can read the question and tell me the answer, guys. Okay, so basically, so the answer is right. The option is B. Okay. According to the DSM-5, it is defined as a problematic pattern of alcohol use leading to clinically significant impairment of distress. Okay. Second question is, how is the severity of alcohol use disorder determined according to the DSM-5 criteria? First option, by the number of times a person has been arrested for alcohol-related offenses. Second, by accessing a person's genetic predisposition to AOD. Third, based on the number of symptoms out of a possible 11 experienced in the past 12 months. The option, by the amount of alcohol consumed in a single setting. Yes, Lakshmi and Raza, the answer is right. Thank you so much. And if I give the explanation why the option is incorrect, because of course legal problems are not used to for severity determination in DSM-5. Like just now I explained the severity, like mild, severe, so that's one. And then B and D, so basically these does describe the factors, but it is which is related to the other substance use, but they are not the basis. Basically they're not the basis for determining the alcohol use disorder according to the DSM-5 criteria. Third question is, which of the following is not listed as a symptom of alcohol use disorder in the DSM-5 criteria? First option, craving or a strong desire or urge to use alcohol. Second, recurrent alcohol use resulting in a failure to fulfill major roles obligation at work, school, or home. Third, reporting feeling happy or euphoric after drinking alcohol. Fourth, alcohol use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to happen caused or exacerbated by alcohol. Also, guys, it is written not listed. Not. Focus on the word not. Yes, Parth and Soumya, the answer is right. Reporting feeling happy or euphoric after drinking alcohol. Okay. Then next question is, which statement best describe the role of genetics and environment in contributing to a person's vulnerability to alcohol use disorder? AOD, first option. AOD is solely caused by environmental factors like stress and trauma. Second, AOD is primarily determined by genetic factors, accounting for nearly 90% of the risk. Third, a complex interplay of genetic and environmental factors contributes to vulnerability. Fourth, genetic and environmental factors, they are distinct and do not interact to influence AOD risk. Yes, Uraza, Lakshmi and Parth, thank you so much. The answer is right. And the reason why, which one? Sorry, the reason why B is incorrect because genetics contribute approximately 40 to 60%. That's why, not 90%. Thank you. Now we'll start with the caffeine use disorder, that is COD. So we are talking about the caffeine. So basically, what is the caffeine, guys? Depressant, hallucinogen, stimulant. First of all, I would like to know this. What is caffeine? Stimulant, depressant, hallucinogen, or what?
Stimulant.
Cool. So basically, caffeine is something, like most of the people rely on, to start our day. It helps us with alert during classes, and even it helps with the late night study session. It happens with me many times, like whenever there is a semester exam, I'll use coffee or Red Bull, just to stay alert, just to avoid sleep. Okay, but basically what happens when there is a cup of coffee, it no longer remains a simple cup of coffee. It basically turns into disorder. So first of all, I would like to talk about the caffeine withdrawal. So according to the DSM-5, caffeine withdrawal is now officially recognized as a diagnosis. Okay, so if I talk about the DSM-4, so it was not like diagnosis. It was just like one of the entity. It's like this means that if someone reduces or stops their daily caffeine intake, they might experience a range of withdrawal symptoms such as headaches, irritability, restless, fatigue, and many of us might have experienced after sipping morning coffee. Like it happens with me that if I don't drink coffee in the morning, so like only morning coffee, so I do feel very irritable, headache. And also I wanted to ask that how many of you guys have ever felt irritable when you had to go without your daily caffeine? Are you guys like dependent on the coffee only for morning? Like how many of you felt irritable like when you had to go without your
Yeah, personal irritability, yeah, but I don't think that counts as withdrawal.
I used to drink coffee a lot, and if I didn't, I just used to feel very groggy and sleepy a lot of the time until and unless I had it. It would be very difficult for me to feel awake. Not exactly irritability to nahi thi, but yeah, it was just kind of a part of my routine, and if it wasn't there, I wasn't that active. So I kind of gave it up because I realized it wasn't a good thing for me.
Okay, thank you so much. Same. I used to feel very, why the professor is even teaching, not to offend anyone. Like I used to feel irritable, but now it's not like that. It was in my during first year. So we studied the caffeine withdrawal. Now coming to the caffeine intoxication. So if I talk about caffeine intoxication, it is acknowledged in both DSM-4 and DSM-5. Okay. So what happens? So basically, when a person consumes more than 250 milligram of caffeine, which is equals to 2-3 cups of coffee, and experiences symptoms like, restless, insomnia, sometimes, your heartbeat is fast. Have you ever guys felt, like hard to sleep even after you have an extra strong coffee? Like, have you ever guys felt, guys, like if you had a strong coffee, so you're not able to sleep?
Yeah.
Definitely. It's happened many times.
Okay,
It's
okay.
common.
Cool. Thank you so much. And another question, guys. Do you think that having a cup of coffee, like, it's the same for everyone, or it's like different for different people in different ways?
For different people in different ways.
Yep. Okay. Thank you so much. So basically, of course, having a, like cup of coffee or caffeine, you can say it's definitely not same. For example, if I talk about, like my past roommate, so she used to feel energized, and she used to like alert just using the one cup of coffee, and another person might feel, anxious and even sleep. So of course, why the effects are different, because just like there's an individual excess, so there's a physiological and psychological difference exist. That's why. Now coming to the caffeine use disorder, COD. And so, even though there is an acknowledgement of caffeine withdrawal and caffeine intoxication, but DSM-5 does not recognize caffeine use disorder, COD. At least अभी तो नहीं किया इन्होंने, ठीक है, but it is currently listed in the section 3rd of the DSM-5. उसको वो कहते हैं, क्या नाम था उसका, emerging measures and models. So अभी like research process में है. And why is it that? Because according to the research, it there's not enough evidence that caffeine used interferes with daily functioning for majority of the people. Yeah, so this is a proposed criteria. So even though like there is no patient diagnosis, so researchers they did propose some criteria which could qualify as COD. So first is have a persistent desire or like unsuccessful efforts to control their caffeine use. Secondly, continue using caffeine even though there's some harm, maybe health problems or social issues. Thirdly, experience withdrawal symptoms when they try to quit or reduce caffeine intake. Yeah, and there's an additional criteria also for severity, like when there's a taken a large amount longer than intended, failure to fulfill major responsibilities, continued use, even though you guys are facing social problems, tolerance, great deal of time spent, craving, activities given up, recurrent use in hazardous situations. Like even you guys are facing negative consequences, you guys are stuck in situation, still you will need the caffeine. Okay, now evidence and research. So according to the evidence and research, so there's some research that supports that the like COD could be a real condition. So according to the studies that have been founded, that the small percentage of caffeine users, they they display the behaviors which is similar to substance dependence. For example, there was this study conducted by Giuliano. Here is it, Giuliano. 93% of participants seeking treatment for caffeine dependence, they met 3 out of 7 criteria for substance dependence. So yeah, it's relying on caffeine, it does affect your well-being. So I wanted to ask you guys that how many cups of coffee or like soft drinks, because soft drinks is also whatever is a stimulant. So how many cups of coffee or any like caffeinated beverage do you think is too many? Like आपके हिसाब से क्या लगता है कि इतना cup of coffee ज़्यादा है?
4-5.
Okay, like 4-5 cups of coffee.
4-5 cups of coffee, like strong coffee, not like milky coffee.
Okay. So you are almost 4-5, but like consuming more than 400 milligram of caffeine, basically 3 to 4 cups of coffee and 4 to 5 cups. So it is considered excessive. Like just like she mentioned, strong. So yeah, excessive basically, and also high caffeine. It can block the that receptor, adenosine receptors. Now, what is adenosine receptor? It is one of the receptors which is responsible for increased anxiety, irritability, and loss of concentration and sleep disturbances.
जैसा आपने बोले ना, वो बिल्कुल सही बात है, भावे मैडम जो बोले, पर ये कॉफी और टी जो है, और टी से ज्यादा कैफीन तो कॉफी में होता है, वो हमारा इंडियन वेदर के हिसाब से नहीं है। वही अगर जैसे जो बहुत चिल्ड रीजन में रहते हैं ना, जहाँ पे स्नोफॉल होता है, आइसिंग, जहाँ पे आइस बहुत ज्यादा होता है, टेम्परेचर 0 डिग्री या माइनस, उन लोगों के लिए 4 to 5 कप ऑफ कॉफी सुटेबल है, पर हम लोगों के लिए नहीं, क्योंकि हम लोग हॉट रीजन में रहते हैं। अब हमारे यहाँ जो कश्मीरी लोग हैं, कश्मीर का रीजन है, वहाँ पे उन लोग को सूट करेगा, पर यहाँ अगर कोई लेता है तो जैसे भाव्या मैडम ने बोला, उसके बॉडी में वैसे साइड इफेक्ट्स होंगे।
हाँ जी बिल्कुल। एंड सेकेंडली जो भी मैंने बताया वो यूएस स्टडी का है।
हाँ, तो मैडम उधर का टेम्परेचर और वेदर हमारे इधर का इन्वायरमेंटल टेम्परेचर वेदर से बिल्कुल डिफरेंट है।
Okay, thank you so much. Okay, now coming to concerns about overdiagnosis. So, like there is one challenge that which is overdiagnosis. So, even though like COD were like recognized, it could lead to an increase in diagnosis. But it's like what I'm trying to say is that if the DSM-5 it requires three specific criteria that was intended to reduce the risk. But like some studies even have shown that people who drink caffeine basically they could admit at least two of the proposed criteria. There's a key question that okay, so the researchers like they are trying to find that even if people are consuming caffeine daily, so what is the line which could turn into a disorder. So that's why there's a there are concerns regarding overdiagnosis. Now coming to the more research needed. Okay, so basically the researchers emphasized that there are need for more studies to better understand the prevalence of COD, its functional consequences and its severity, and there are like future implications like just like mentioned. Need to agree on the despite harm definition, and there should be like official recognition, and the researcher is also trying to find out that what is the like caffeine intake which could turn into a disorder. Yeah, that's it. And coming to the case study. Okay, so guys, how many of you know the like one of the famous American author, Hemingway?
Yeah, I'm not the literary guy. You gotta ask someone else here.
Acha, do you know that author who wrote the Great Gatsby?
You're just saying random people's names at this point, bhai.
No, I wrote the name of the mention names of the.
Something I think Fitzgerald or something, right?
Yep. Thank you so much. So basically, he was also diagnosed of. He was dependent on caffeine basically, but here I'm talking about Hemingway. So he was he was famous for his books like the Old Man and the Sea and the Farewell to Arms. And no, I did not read this novel. I got it from the Google. But yeah, I know that he's very famous. So basically, he was heavily dependent on drinking coffee. He reportedly it was found that he used to drink 10 cups of coffee a day, especially during the morning morning writing session. And it was not a casual drink for me. It was like a tool which he was dependent upon for his creative purposes, because it used to help him to alert to concentrate. And even though there was health risks like insomnia and anxiety, he did not cut his caffeine intake, and secondly continued use despite them. So he did face the mood swings, emotional lows, and poor sleep, but the coffee stayed. And then thirdly, possible withdrawal. So basically, there wasn't there was an exact record that his dependence on caffeine. There were withdrawal symptoms. There was no reported, but he did have the mood swings, insomnia, poor sleep, basically insomnia only, emotional lows, and that's it. That was the case study. Cannabis use disorder. So talking about the cannabis use disorder, so COD basically it refers to a condition where a person cannabis use causes distress or dysfunction in their life, and it lasts for at least 2 months. 2 months, 12 months. And it's just not about occasional use. This disorder involves at least two symptoms, such as using more than intended, failing to cut down, even if he or she is trying to, and continuing to use cannabis, even it's harming relationships or responsibilities. Now, secondly, is epidemiology and risk factors. So, cannabis use is widespread, especially among adolescents and young adults, and I think it was found out 4% of the global population, according to this study in 2015. Okay, and then 9% of the cannabis user will experience addiction, with a fifth of those starting during their teenage years. So basically, the people who was consuming the cannabis during their young years, so they will experience the addiction. Now talking, now talking about the pathophysiology and toxicokinetics. So basically, there's the psychoactive compounds in cannabis, which is known as THC, and if I'm pronouncing delta-9 tetrahydrocannabinol. So it is a powerful effect on the brain. So basically, THC interacts with the receptor, which is known as CB1 receptor. Now, what is CB1 receptor? It leads to the feelings of euphoria, perceptions, relaxations. So when a person is consuming the cannabis, it can alter the brain chemistry, which affects the concentration, focus, memory, and of course emotional regulation. Now, THC, like what is THC? I forgot to tell, sorry. So basically, it is a lipophilic. Now, what is lipophilic? It is a fat soluble, and it accumulates with the fatty tissues. So that's why cannabis, it stays in your system for extended periods. Why? Because it accumulates with the fatty tissues. And if I talk about the duration, at least up to a month. Now, if I talk about the clinical presentation and diagnosis, so how do we recognize cannabis use disorder in a clinical, settings? If I talk about the symptoms of the intoxication, it includes things like, increased appetite, dry mouth, restlessness, and there's also withdrawal to consider. So after a long-term usage, when a people they are consuming for a long term, so they may experience anxiety, sleep disturbances, irritability, and also the basically physical symptoms like sweatings or headaches. And if I talk about the duration of the symptoms, it can last up to 2 weeks. Now, coming to the construct validity of DSM-5, basically the DSM-5 construct validity, researchers have found that the more a criteria person meets, the more the severe disorder, and the more likely that it experiences psychiatric and social impairments. So it is linked to these disorders like depression or anxiety. And if I talk about the treatment and management, so treatment like why you have cognitive behavioral therapy and the family therapy, and also there's no medications. Just like we have the medications for alcohol, but we don't have the medication if the people is consuming, cannabis. Now coming to the complication and adverse effects. So basically, if I talk about the short-term effect, it can include the it affects the memory. It leads to the impairment of memory and basically cognitive impairments, addiction, and even psychosis. And of course, in adolescents, it's particularly harmful, and it does leads to the poor academic outcomes and decline in IQ. And if I talk about patient education and deterrence, basically, if I talk about the adolescents and pregnant individuals, so it is a lot of risk on the cannabis use. A lot of people still believe that cannabis is harmless. If you guys remember that Saiba explained that theory, the gateway of the cannabis theory, that it is a mislead theory that if people is consuming the cannabis, so there will be a probability that people would try the harder drugs. And there are some places that cannabis is harmless. Sorry, cannabis is legalized, so people think that it is harmless, but it's not. Especially when it comes to brain development, pregnancy, and of course long-term mental health. Now, if I talk about the peers and other tissues, so what is peers? It means practical tips. So like withdrawal symptoms like irritability, sleep disturbances, and decreased appetite. It may not be severe, but it can cause distress and relapses if it is not untreated. And if I talk about the early use, especially during adolescence, so it is strongly associated with the, they will be addicted, and they would develop the cannabis use disorder. There are cannabis products like, wax, it can lead to a quicker development of tolerance. Now, if I talk about the other issues, so just like I mentioned that the cannabis, it is legalized in places. So due to the legalization and public perception, so people think that just because cannabis is legalized in many places, so people perceive it as harmless, and that's why it does and that's why even if we educate people, they do not take that much seriously. Now there's this one more syndrome which is known as cannabis hypermesis syndrome. So it is very rare, but it is an important condition, and it if a person is chronic user, it causes severe vomiting. And yeah, that's it. Now, if I talk about the case study, how many of you guys know Miley Cyrus?
Me.
Like to know that. Okay, so basically Miley Cyrus, whom we know as Pride, Bold, and yeah, of course we saw her in a Hannah Montana. But Miley Cyrus, she did go through the personal patterns, and which were during her early 20s, she was dependent upon cannabis, and it wasn't just occasional, it was habitual. She admitted the fact that, like, she used to have the cannabis all day. Like, if she woke up, she will consume cannabis, and she used to end the day with cannabis only. So it might seem like, she's just being rebellious, but she did face the, consequences. Like, she was not facing the issue of, that she was not able to control. She was consuming more than intended, and around 2017, she decided to quit cannabis, and she described that she was emotionally present now, and she can reconnect with her creativity, and now her memory becomes sharper. Like, basically, it's not playing with her memory, like, impairing with her mind. Yeah, that's it. Thank you so much, guys.